So what are the treatment protocols that we use for the treatment of the high blood pressure patient? In every patient, lifestyle modification is an important part of treatment. The first part is salt restriction. So patients who have a high salt intake may prevent the medications that we use from working. And so we recommend a salt-restricted diet. That means no longer eating pickles, pretzels, potato chips, olives, and anchovies. Avoiding canned soups and vegetables, or other canned foods, such as tomato paste or tomatoes, all of which have high salt content. Avoiding foods in bottles, with the exception, if you will, of water, juice, alcohol, olive oil, or milk, for example, because canned sauces like tomato sauce, barbecue sauce, steak sauce, soy sauce, all have an extraordinary amount of salt, as do pasta sauce, chip dip, and other bottled materials. We also avoid luncheon meats, fast food, and pizza that are characterized as having high salt. And many cheeses, including especially feta or Greek cheese, have an extraordinary amount of salt that need to be avoided. Some breakfast cereals, such as Cheerios, Corn Flakes, Raisin Bran, and Wheaties, have an excess amount of salt. And so we recommend low-salt foods, fresh fruits and vegetables, shredded wheat, oatmeal, cream of wheat, puffed rice, or puffed wheat as alternatives to some of those high-salt containing foods. Another important component of lifestyle modification is exercise. Even if your weight doesn't change, increased physical activity, running, jogging, biking, swimming, exercises where you're in motion, will reduce your blood pressure. And of course, if you need to lose weight, reducing your weight can be very effective in lowering your blood pressure as well. Excessive alcohol ingestion will increase your blood pressure and should be avoided. And of course, tobacco abuse, cigarette smoking, increases your blood pressure, increases your risk of heart attack and stroke, and increases your risk of lung cancer, and therefore should be discontinued. Treatment of high blood pressure is often based on the use of antihypertensive medications. We have some 200 blood pressure lowering drugs in 7 or 8 classes of antihypertensive medication. These include diuretics, beta blockers, alpha blockers, ACE inhibitors, angiotensin receptor blockers, direct renin inhibitors, calcium antagonists, and sympatholytics. It's not important that you remember the type of drug, but it is important that you remember what drug you are taking. These drugs are used alone or in combination to lower your blood pressure to the target value. Now, it is clearly true that most, if not all, of the antihypertensive medications potentially have side effects. But what we try to do is to develop an individual combination of drugs that works for you in order to lower your blood pressure without producing side effects. Some of those side effects may be fatigue, or depression, or sexual dysfunction, or swollen ankles. And if you develop these side effects on your medications, you should talk to your physician, because the medications can be changed, the doses can be modified, the combinations can be altered to avoid side effects so your blood pressure can be controlled without these adverse experiences. What about if your blood pressure is not controlled despite many medications, or you have many side effects and don't tolerate drugs, or you've exercised, you've lost weight, and you've cut down on your intake of salt? Is there any option left for you? Well, indeed there is. We, for example, tested acupuncture as a strategy for lowering blood pressure. Unfortunately, it doesn't work. But relaxation response therapy, a form of meditation, does work, and it can be used alone or in combination with medication to lower your blood pressure. High blood pressure is extraordinarily common. 20% of Americans will have values greater than 140/90. Treating your high blood pressure reduces your risk of heart attack, stroke, death, and kidney disease. If you have high blood pressure, if you've been told you have an elevated blood pressure value, discuss the need for treatment with your primary care physician or with a specialist who may be able to help you to control your blood pressure effectively.